Social workers frequently face resistance from clients when attempting to facilitate change, and understanding how to work through opposition in a critical. The three vital tools for working through opposition to change are active listening, empathy, and rapport building. Active listening. This tool involves giving full attention to the client and reflecting on their concerns without judgment. Active listening helps the client feel heard, which can reduce defensiveness and open up opportunities for growth. When clients feel understood, they are more likely to engage in the process of change. Empathy. Being able to express empathy means understanding and validating the client's emotions and experiences by showing genuine care and concern. Social workers build the trust, which is essential when challenging behaviors or attitude are present. This trust helps the client feel safe enough to address the difficult emotions that may be contributing to resistance to a change. Rapport building. Establishing a positive and supportive relationship is essential. Rapport building helps a client feel comfortable and willing to engage in change. When clients trust the social worker, they are more likely to open to discussing their behaviors, feelings, and challenges, which is critical for achieving the targeted change outcomes. Each of these tools are important for overcoming resistance and promoting long-term change. Active listening makes the clients feel valued. Empathy helps to soften resistance, and rapport building establishes a foundation for helping relationship. As a social worker, being able to recognize and assess behavior is essential in helping clients navigate the challenges they face. In my opinion, self awareness plays a critical role in identifying problematic behaviors. I must be mindful of the client's body language, communication patterns, and the emotions that arise during interaction. Recognizing these behaviors allows me to make informed decisions about how best to support the client and address their needs. Assessment should not only be about identifying what is not working, but also understanding what is driving the behavior, whether it's past trauma, current stress, or other underlying factors. In the context of helping relationship, using myself as a powerful tool to be effective, I need to understand my own reactions and biases when faced with opposition. For example, if a client is being resistant, my self-awareness helps me respond with patience rather than frustration. I must also avoid imposing my values or expectations onto the client by recognizing my emotions and maintaining an open, non-judgmental stance. I can build trust with the client, encourage them to consider change in their own way, at their own pace. I believe I can appropriately use myself in the helping relationship, but I also acknowledge the need of ongoing self-reflection. Sometimes I may encounter situations that challenge my ability to remain neutral or empathetic, and it is important to have strategies in place to maintain effectiveness in these moments. To improve my ability to assess behavior and apply the use of self, I would benefit from additional training in advanced therapeutic techniques such as cognitive behavioral therapy, CBT, or motivational interviewing. These methods provide structures, ways of addressing problematic behavior, and guiding clients through resistance. Additionally, supervision and peer support are critical in helping social workers navigate challenging cases. By learning from colleagues, receiving feedbacks, and engaging in self-reflection, I can refine my skills and provide more effective support for clients. In conclusion, working through opposition to change requires patience, active listening, empathy, and rapport building, recognizing and assisting behavior in helping relationship involve observing the client's actions and emotional responses while using myself requires self-awareness and the ability to manage my own reactions. To enhance my skills, I would seek additional training, therapy approaches, and rely on supervision and peer support to continue developing as a practitioner.